Welcome back, everybody. Today, we're going to be taking a deep dive into bipolar disorder.
Okay.
This is a condition that a listener specifically asked about, and,
Fine.
it's notorious for some pretty intense mood swings that can really mess with your life.
Yeah.
And we've got all the listener sources right here, a bunch of articles, some personal notes,
Interesting.
really fascinating stuff. And we're going to try to break it all down together.
Yeah, it seems like the listener's really trying to understand not only like what bipolar disorder is,
Yeah,
but also like maybe how it connects to some of their own experiences,
exactly.
especially with that family history.
Yeah, that's a big one for sure.
Yeah.
I mean, I know that it has something to do with like huge mood swings,
Yeah.
going from like super high energy to
Right.
like totally
Yeah.
down in the dumps. But what is actually happening in the brain?
Well, think of your brain like a really complex electrical system.
Okay.
You got all these chemicals called neurotransmitters that are constantly like firing off signals,
Mm.
kind of like electrical impulses.
Yeah. Okay.
Now, in bipolar disorder, three key neurotransmitters are kind of out of whack.
Oh,
Dopamine,
okay.
serotonin, and noradrenaline.
All right. Yeah.
They're not communicating the way that they should be, and it
Right.
kind of throws off the whole balance of your mood.
So it's like a communication breakdown in the brain.
Exactly.
Okay. All
Yeah.
right. That makes sense.
Yeah.
In my notes, though, I did see something called the diathesis stress model.
Oh, yeah.
What is that and how does it fit into all of this?
Good catch. That's a really important concept here.
Okay.
That model essentially says that you might have like a genetic predisposition to bipolar disorder,
Okay.
but it usually takes like a stressful event to actually trigger it.
So you might be more susceptible to it, but you don't necessarily have it.
Exactly. Like imagine a seed.
Okay.
That predisposition is like a seed.
Mm-hmm.
It's there, but it needs the right conditions to like sprout and grow.
So the stress is like the water in the sun.
Exactly.
Okay, so let me see if I'm getting this straight. My family history, like if it has bipolar disorder in it, that might mean that I have that seed, that higher chance of developing it. But then something stressful happens, like,
Yeah.
I don't know, like a big move or like huge deadline at work.
Right.
And that could be the trigger.
Exactly. You got it.
Okay.
And, it doesn't have to be these like huge life events either.
Yeah.
Your notes actually specifically mentioned your recent sleep troubles.
Oh, yeah.
And how that seems connected to those mood swings.
Yeah, for sure.
It's a perfect example of how even like small changes in your routine
Okay.
can disrupt that delicate balance.
Wow. Okay, so even just like not sleeping enough can play a role?
Mm-hmm.
Huh. That's kind of unsettling, honestly.
Yeah.
Like, I knew stress would be a factor, but I didn't realize it was so connected.
Yeah, it can be a lot to take in.
Yeah.
But knowing this can really help us understand how to like better manage the condition through different treatments,
Okay.
traditional and alternative.
Speaking of treatments, one of the articles that you sent me mentioned transcranial magnetic stimulation, or TMS.
Mm-hmm.
It sounds pretty high-tech. Is that something worth looking into?
TMS is definitely gaining a lot of traction as a treatment option.
Okay.
It's non-invasive,
Right.
meaning no surgery or anything like that.
Okay.
And it seems to have a pretty good track record,
Mm-hmm.
especially for people who don't find full relief with medication.
Hold on. Can we back up a sec?
Sure.
You mentioned medication. Is that usually the go-to for bipolar disorder?
It often is, yeah.
Okay.
Medications can help regulate those neurotransmitters we talked about,
Mm-hmm.
bring them back into balance,
Oh.
but they can also come with side effects,
Yeah, that's true.
which is why TMS is becoming a more popular alternative.
That makes sense. So how does TMS actually work? Is it like those brain zapping scenes from sci-fi movies?
Not quite as dramatic.
Okay.
Basically,
Mhm.
it involves using these targeted magnetic pulses
Okay.
to stimulate specific areas of your brain.
Mm.
Imagine it like gently nudging those neurotransmitters back into alignment.
So it's like a gentler, more targeted approach than medication.
Yeah, you could say that.
Okay.
And importantly, it doesn't seem to impact memory or have the same kind of side effects that some medications do.
Okay.
We're starting to see some really promising results with TMS, especially for people who have struggled with more traditional treatments.
Oh, wow. Okay, that's really interesting.
Yeah.
What about other types of therapy? My notes mentioned something called CBT. Is that something I should be considering as well?
Cognitive behavioral therapy, CBT.
Yeah.
It's a really valuable tool
Okay.
for managing bipolar disorder.
Right.
It helps you kind of identify those like negative thought patterns and behaviors
Mm-hmm.
that can contribute to those mood swings, and it teaches you strategies to change them.
So it's not just about treating the symptoms, it's about learning to like manage the condition
Yeah,
right today.
Absolutely. CBT can help you develop coping mechanisms and build resilience,
Okay.
so you're better equipped to handle those ups and downs.
So we've got medication, TMS, and CBT. That's quite a range of options.
It is, and there's one more crucial piece we shouldn't overlook:
Okay, what's that?
lifestyle modifications.
Oh, right. Things like exercise and diet and stuff like that.
Exactly. Things like regular sleep,
Yeah.
healthy eating, stress management can have a huge impact on mood stability.
Okay.
They provide that foundation of well-being that can make all the difference in managing bipolar disorder.
Wow. I'm realizing just how much there is to consider.
Yeah.
It's not just about treating the symptoms, it's about taking a holistic approach to my mental health.
You've hit the nail on the head. It's about understanding the interplay of your biology, your
Yeah.
environment, and your own choices.
This is all really eye-opening. I'm starting to understand just how complex this condition is, but it also sounds like there are a lot of different ways to approach treatment and find what works best for me.
That's the key takeaway here.
Okay.
Bipolar disorder may be challenging, but it's not a life sentence. With the right knowledge and support, you can absolutely live a full and meaningful life.
That's reassuring to hear. Before we move on, though, one thing's really sticking with me. We talked about how even something like lack of sleep can be a trigger.
Right. It shows just how sensitive the brain can be, especially when it comes to bipolar disorder.
Exactly. So if even small changes can have such a big impact, what does that tell us about the importance of self-care and really paying attention to our mental and physical well-being?
That's a great question. And it's something we should all be mindful of.
Yeah.
Whether we're dealing with bipolar disorder or not,
Right.
our mental health is precious and it deserves our attention and care.
Absolutely. This has been a really insightful deep dive so far.
Yeah.
It's made me realize that there's so much more to learn about bipolar disorder and how it affects people's lives.
Absolutely. And there's a wealth of information in your sources that we can delve into
Okay.
to give you a deeper understanding of this complex condition.
Well, then let's keep digging. I'm eager to learn more, especially about those triggers we were talking about.
Okay.
What specific types of things should I be aware of?
Let's take a closer look at your sources. They actually categorize these triggers into different types:
Okay.
trauma, interpersonal conflicts, major life changes, and substance use.
Right.
Each of these can play a significant role in triggering those mood episodes,
Okay.
and understanding them is key to managing bipolar disorder effectively.
That makes sense. Let's break those down one by one. First up, trauma.
Okay.
I know that that can have a huge impact on mental health, but how exactly does it relate to bipolar disorder?
Well, trauma can be like a really powerful trigger for bipolar disorder.
Okay.
It's important to remember that the brain is super sensitive to stressful experiences.
Yeah.
And for someone with a predisposition to bipolar disorder,
Right.
those experiences can really disrupt the balance of neurotransmitters, leading to mood episodes.
That makes sense.
Yeah.
Trauma can really shake you to your core.
Making it harder to regulate emotions.
Exactly.
But what kinds of experiences are we talking about here?
Well, trauma, encompasses a really wide range of events.
Okay.
It could be something like physical or sexual abuse,
Right?
a really serious accident,
Mm-hmm.
witnessing violence, or even experiencing a natural disaster.
Oh, wow.
These events can really leave deep emotional scars
Yeah.
and make someone much more vulnerable
Okay.
to the ups and downs of bipolar disorder.
One of the sources you sent mentioned childhood trauma specifically.
Yes.
Why would that be particularly impactful?
Well, think about it.
Okay.
Childhood is a time of rapid brain development.
Right.
When a child experiences a trauma, it can actually alter the way their brain develops and functions,
Oh, wow.
making them much more susceptible to mental health conditions later in life,
Okay.
including bipolar disorder.
So early intervention and support for children who've experienced trauma could be crucial
Absolutely.
in preventing or mitigating the effects of bipolar disorder. Early intervention can make a huge difference.
Right.
It's about providing those children with the tools and the support they need
Right.
to process their trauma, build resilience, and develop those healthy coping mechanisms.
That's a powerful insight. It's not just about treating the symptoms of bipolar disorder.
Right.
It's about addressing those root causes
Mm-hmm.
and providing support at every stage of life.
Exactly. A holistic approach to mental health care.
Got like that.
Now, moving on from trauma, your sources also highlighted the significance of interpersonal conflicts
Okay.
as potential triggers, especially within families.
That's interesting. Why would family conflicts be so potent in triggering bipolar episodes?
I mean, all families argue it's normal, right?
Conflict is definitely a natural part of any relationship.
Yeah.
But for someone with bipolar disorder, those
Okay.
conflicts can be particularly challenging.
Hmm.
Family dynamics often tap into like those really deep-seated emotions and vulnerabilities.
Right.
And when those are triggered, it can disrupt that balance in the brain.
Leading to those mood swings.
So it's not just the argument itself, it's the emotional weight it carries.
Exactly.
Okay.
And it's important to note that it's not just negative interactions that can be triggers.
Oh,
Even positive changes in family dynamics,
okay.
like a marriage or the birth of a child, can bring about stress and adjustments
Right.
that could potentially trigger an episode.
That's something I hadn't really considered before. It seems counterintuitive that positive changes could be stressful.
Yeah.
But I guess any major life change requires adaptation,
Mm-hmm.
which can be challenging for anyone, especially someone with bipolar disorder.
Exactly. And speaking of major life changes, your sources mentioned that those are another significant category of triggers.
Right. We talked about that a bit earlier, things like moving, starting a new job,
Yeah.
even getting married or divorced.
Mm-hmm.
But I'm still a little fuzzy on why these seemingly normal life events
Yeah.
could trigger bipolar episodes.
Well, think about it this way.
Okay.
These events, even the positive ones, often disrupt our routines,
Right.
our social networks,
Right.
and our sense of stability.
Yeah.
And for someone with bipolar disorder,
Mm-hmm.
that disruption can be really unsettling and throw off their emotional equilibrium.
It's like shaking up a snow globe. It might be pretty to look at, but it takes time for everything to settle back down.
That's a great analogy.
Thanks.
And for someone with bipolar disorder, that settling down process can be a lot more turbulent.
Okay.
Their brain chemistry is already more sensitive
Right.
to fluctuations. So
Yeah.
these life changes can really amplify those fluctuations and lead to more pronounced mood swings.
So it's not that these life events are inherently bad. It's the way they impact the brain's balance that can be problematic for someone with bipolar disorder.
Exactly.
Okay.
And that's why it's so important to have coping mechanisms in place
Yeah.
to manage those transitions and kind of minimize the
Plus-
impact on mood.
Okay, that makes a lot of sense. So we've got trauma, interpersonal conflicts, and major life changes, all potential triggers for bipolar episodes. What was that last category you mentioned?
The last category is substance use.
Right.
This one is particularly important because substances like alcohol and drugs
Yeah.
can directly impact brain chemistry, often in ways that exacerbate
Mm-hmm.
the symptoms of bipolar disorder.
Right, we touched on that earlier. I remember you saying that alcohol is a depressant.
Yeah,
So it can worsen those depressive episodes.
exactly.
But what about other substances?
Well, it depends on the substance.
Uh-huh.
Stimulants like cocaine or amphetamines
Right.
can actually trigger manic episodes.
Oh, wow.
They kind of flood the brain with dopamine,
Okay.
creating a sense of euphoria and energy that mimics mania.
Okay.
But it's a dangerous and unsustainable high.
Right.
The crash that follows can be really severe and often leads to a depressive episode.
So it's like a roller coaster ride, a quick thrill followed by a deep plunge.
Exactly.
And for someone with bipolar disorder, that plunge can be even more intense.
Exactly. And it's not just illegal drugs.
Okay.
Even some prescription medications, if not used as directed, can interact with the brain chemistry of someone with bipolar disorder
Okay.
and trigger mood swings.
That's a lot to consider.
It is.
It makes me realize that managing bipolar disorder involves being really mindful of everything that can impact your mental state,
Yeah.
from major life events to
Right.
the substances you put into your body.
You've hit the nail on the head.
Okay.
It's about taking like a proactive approach to your mental health
Mm-hmm.
and creating a lifestyle that supports stability and well-being.
Okay.
And it's about recognizing that even seemingly small things like a change in your routine or a stressful interaction
Right.
can have a ripple effect
Okay.
on your mood.
That's a powerful insight. It's not just about avoiding major triggers. It's about being attuned to those subtle shifts in your mental state and having strategies in place to manage them.
Exactly. And speaking of strategies, let's shift our focus to treatment options.
Okay.
We've already touched on medication, but your sources delve into a fascinating range of alternative therapies, like transcranial magnetic stimulation, which we discussed earlier.
Right. TMS.
Yeah.
That's the one that uses magnetic pulses to stimulate the brain.
Right.
I'm really curious to learn more about how that works and how effective it is.
It's a fascinating treatment modality.
Yeah.
And the research on its efficacy in treating bipolar disorder is really quite promising.
Okay.
Shall we dive into the detail?
Absolutely. Let's explore how TMS is being used to help people manage bipolar disorder and reclaim their lives. All right, so we're back and ready to unpack this transcranial magnetic stimulation. TMS for short.
Yeah.
Sounds kind of like something straight out of a sci-fi movie.
It does have like a futuristic ring to it,
Right.
but TMS is a very real and increasingly popular treatment option for bipolar disorder.
Okay.
As we touched on, it uses magnetic pulses to stimulate specific areas of the brain.
Right.
And the research suggests it can be really effective in managing those mood swings.
So how does it actually work? Do you have to like shave your head and like hook up electrodes or something?
Nothing quite so dramatic.
Okay, good.
The procedure itself is surprisingly straightforward.
Okay.
You just sit comfortably in a chair,
Right.
and a device that resembles a helmet is placed near your head.
Okay.
And this device delivers those targeted magnetic pulses, usually to the prefrontal cortex,
Okay.
which plays a key role in regulating mood.
All right. That sounds a lot less intimidating than I imagined.
Well,
But how do those magnetic pulses actually affect the brain?
think of it like a gentle nudge to the brain's electrical system.
Okay.
Those magnetic pulses induce tiny electrical currents in the targeted area, which in turn influence the activity of neurotransmitters,
Okay.
those chemical messengers that we've been talking about.
So it's kind of like jump-starting those neurotransmitters back into a more balanced state.
That's a great way to think about it.
Okay.
And what's particularly encouraging is that TMS doesn't seem to have the same kind of like widespread impact on the brain that medication can have.
Okay.
It's a much more localized and targeted approach.
So more precise?
Exactly.
My notes mention that like a typical treatment course involves several sessions over a few weeks.
Right.
What does that actually look like in practice?
Usually patients undergo TMS sessions 5 days a week
Okay.
for anywhere from 2 to 6 weeks.
All right.
Each session lasts about 30 to 40 minutes,
Mm-hmm.
and the patient remains awake and alert
Okay.
throughout the entire process.
That's really interesting. And you mentioned earlier that it's generally well tolerated.
Yeah.
What are like the potential side effects?
Most people experience very minimal side effects.
Okay.
Some might report mild headaches or scalp discomfort
Okay.
at the treatment site.
Mm.
But those tend to subside really quickly.
Right.
Serious side effects are very rare,
Okay.
which is a major plus for TMS
Yeah.
compared to some medications.
That all sounds really promising, but I have to ask like the million-dollar question, does it actually work?
That is the most important question, of course.
Yeah, right.
And the research is increasingly pointing to yes. Numerous studies have shown that TMS can be highly effective in treating both depressive and manic episodes
Wow.
in individuals with bipolar disorder.
That's encouraging to hear. So if someone is struggling with traditional medication, either due to like lack of efficacy or side effects, TMS could be a viable alternative.
Absolutely. And that's precisely why it's gaining so much traction in the mental health field.
Yeah.
It's providing hope and relief to individuals who haven't found success with other treatment approaches.
That's amazing. It sounds like it could be a real game changer for a lot of people.
It really could.
But you know, as fascinating as TMS is, your sources also emphasize that it's not a standalone solution.
Right.
There's still a big emphasis on therapy and lifestyle changes, right?
TMS can be incredibly effective in managing symptoms,
Okay.
but it's crucial to address those underlying emotional and behavioral patterns that contribute to bipolar disorder.
Right.
That's where therapy comes in.
Makes sense. We talked about CBT earlier. Is that like the main type of therapy used for bipolar disorder?
CBT is definitely one of the most widely used and researched therapies for bipolar disorder,
Okay.
and it's shown to be highly effective.
Right.
It helps individuals identify those negative thought patterns and behaviors that can fuel those mood swings.
Right.
And that provides practical tools to change those patterns.
So it's like rewiring the brain, so to speak, to respond to challenges in a healthier way.
That's a great way to put it.
Cool.
CBT empowers individuals to become active participants in their own recovery,
Okay.
equipping them with the skills to manage their condition and navigate life's ups and downs more effectively.
I'm starting to see how all of these pieces fit together.
Yeah.
Medication or TMS to manage the biological aspect, CBT to address the psychological component,
Right.
and then lifestyle changes to provide that foundation of overall well-being.
You got it. It's about taking a holistic approach,
Okay.
recognizing that bipolar disorder is a complex condition
Yeah.
that requires a multifaceted treatment plan tailored to each individual's unique needs.
This has been a really insightful deep dive.
It has.
It's clear that bipolar disorder is challenging,
Yeah.
but it's also clear that there's hope, there's help, and there's a path toward recovery.
And that's the most important message to leave with
Think that.
listeners today.
Yeah.
While bipolar disorder may be part of their story, it doesn't define their story.
I love that. It's a reminder that knowledge is power, And understanding this condition is the first step towards taking control and living a fulfilling life.
Absolutely. And remember, you're not alone in this journey.
Mm-hmm.
There are countless resources available,
Right.
supportive communities and mental health professionals ready to help.
This has been an incredibly enlightening conversation.
It has.
And I feel like I've gained a much deeper understanding of bipolar disorder. Not just the facts and figures, but like the human experience behind it.
It's been my pleasure to join you on this deep dive.
Thank you so much for sharing your expertise and insights. And to all of you listening out there, we encourage you to keep learning, keep exploring, and keep reaching out for support. Remember, you're stronger than you think, and there's always hope. Take care.